Sudden weakness affecting one side of the body is a symptom that should never be ignored. This abrupt loss of strength can signal a serious problem within the brain, such as a stroke or another neurological emergency. Recognizing this warning sign is crucial, as timely medical intervention can make a significant difference in outcomes. The onset of one-sided weakness often points to a disruption in blood flow or damage to specific areas of the brain responsible for movement. Acting quickly when this symptom appears can help prevent long-term disability and even save lives. Understanding the urgency behind this sign empowers individuals to seek immediate help when it matters most.
Hemiparalysis and hemiplegia are neurological conditions that affect movement and strength on one side of the body. Hemiparesis refers to weakness or partial loss of muscle strength, while hemiplegia describes complete paralysis on one side. These conditions often result from damage to the brain, such as a stroke or traumatic injury. Patients with hemiparesis may experience difficulty with coordination, walking, or performing daily tasks, but some movement is still possible. In contrast, those with hemiplegia lose all voluntary movement on the affected side, making mobility and self-care significantly more challenging. Both conditions can impact sensation, balance, and reflexes, and may require rehabilitation to improve function and independence. One-sided weakness, also known as hemiparesis, often originates from disruptions within the brain's motor pathways. The motor cortex, located in the frontal lobe, plays a central role in controlling voluntary muscle movements. Interestingly, each side of the motor cortex governs movement on the opposite side of the body, a phenomenon known as contralateral control. This means that damage to the left motor cortex typically results in weakness on the right side of the body, and vice versa. Such disruptions can be caused by conditions like stroke, traumatic brain injury, or tumors. Understanding this relationship helps clinicians pinpoint the location of neurological injuries and guide appropriate treatment strategies. Stroke is most commonly caused by either a brain hemorrhage, known as Schwat Huet Nau, or by a blockage in one of the brain's arteries. In a brain hemorrhage, a blood vessel ruptures, leading to bleeding within the brain tissue. This sudden influx of blood can damage surrounding brain cells and increase pressure inside the skull. Alternatively, when an artery becomes blocked, blood flow to a part of the brain is interrupted, depriving it of oxygen and essential nutrients. Both scenarios result in the death of brain cells in the affected area. Since these regions often control movement, their impairment can lead to significant disruptions in motor function, such as weakness, paralysis, or loss of coordination. To quickly assess for hemiparesis, begin by observing the person's gait. Ask them to walk a short distance and note any asymmetry, dragging of one leg, or difficulty lifting a foot. Next, evaluate grip strength by having the individual squeeze your fingers with each hand, comparing the force on both sides. A noticeable weakness or inability to maintain grip on one side may indicate hemiparesis. These simple checks can provide valuable information about possible neurological deficits and help guide further evaluation. Even mild or temporary weakness should never be dismissed as insignificant. Sometimes, what appears to be a minor issue can actually signal a more serious underlying medical condition. Early recognition of these warning signs is crucial, as prompt medical attention can make a significant difference in outcomes. Ignoring or downplaying symptoms may delay necessary treatment and potentially worsen the situation. It's important to listen to your body and seek professional advice if you experience unexplained weakness, even if it seems to resolve on its own. Sudden one-sided weakness can be a warning sign of a serious medical condition, such as a stroke. Immediate evaluation is essential because early treatment can significantly improve outcomes and reduce the risk of long-term disability. Delaying medical attention may lead to irreversible damage to the brain or other vital organs. Emergency evaluation allows healthcare professionals to quickly identify the underlying cause and initiate appropriate interventions. Recognizing the urgency of these symptoms can make a crucial difference in recovery and overall prognosis. If you or someone you know experiences sudden weakness on one side of the body, seeking prompt medical care is vital. Staying informed about neurological emergencies can make a significant difference in critical moments. By learning how to recognize early warning signs and understanding the appropriate responses, you equip yourself to help others and potentially save lives. Continued education ensures you remain prepared for unexpected situations. Explore more resources and guidance to deepen your knowledge and confidence in handling neurological emergencies.